Hello, I am Chris Jung, and this is a presentation about conversion disorder. Conversion disorder is also a functional neurological disorder. It is characterized by blindness and/or paralysis. It renders certain parts of the body obsolete, not in the sense of movement, but a lack of control. It is typically not the cause of one single event, but rather it follows a period of severe emotional or physical distress. The DSM-5 based symptoms include the previously mentioned paralysis, abnormal movement, loss of balance, difficulty swallowing, and seizures. This next slide goes further into additional symptoms, but it is mainly characterized by the loss of ability to control and use limbs and other body parts. Risk factors for this disorder include being subject to similar conditions such as epilepsy or separate disorders such as dissociative disorder. Social and external factors consist of family experience of this condition and previous stressful experiences. This disorder, like all other conditions, is a source for depression. Negative psychological influences may be reinforced with the stress that comes with the inability to do basic tasks. Thus, it is relatively easy to fall deeper into this condition, and even with therapy, it is highly susceptible to relapse. However, with the right therapy and guidance, it can be managed. Cognitive behavioral therapy is a big one, as it gives the opportunity for the person experiencing this to learn more about their condition, recognize triggers and symptoms, and learn new ways to respond and control. Medications and stress management training may be additional solutions to cope and manage. The impact this disorder has on close family members is first, the responsibility. People with this disorder require significant care and attention by close relatives. And social effects include lack of response when prompted and just overall sadness at the whole situation. Here's a video that demonstrates conversion disorder.
So 100 years ago, everyone was talking about conversion disorder. It was big news, and it was big news because in the First World War, there was an epidemic of it. What conversion disorder is a set of neurological symptoms that could be very different between different patients. But when you look into their brains, you can't find any damage that would explain it. The brain looks normal, the nerves work normally.
It's a physical manifestation of a psychological condition.
It's not something which is fabricated or put on by the patient, but it's something which is automatically occurring as an avoidance of some kind of underlying stress or anxiety, and automatically being converted into a very real and often very functionally impairing horrible symptom.
Symptoms that may present in conversion disorder patients are paralysis, seizures, blindness or hearing impairment, and loss of speech. The severity varies, but for most sufferers, it's a crippling condition.
So 100 years ago, everyone was
Here are my sources, and thank you for watching this presentation.